I'm Lisa Gable, and in my life, I've been blessed with amazing opportunities. From working in the White House at 21 to running some of the most impactful global organizations. I've had the incredible fortune to learn from and work with remarkable women who blazed a trail before me. From ingenuity, I learned to demand unity of purpose. From former Air Force Secretary Barbara Barrett, I learned to replace myself with another woman when exiting a high-level position. Women helping women is how we solve tough problems, whether it's giving voice to food allergy moms to mentoring our rising leaders. On this inspiring interview series, I have the privilege of sharing the wisdom from some of the most remarkable women on the planet. Women I'm proud to call my friends and colleagues. Their advice is priceless, so join me right now for another inspirational conversation. This is Breakthrough.
Today's episode is about the power to make a difference. Joining me today is a woman who built an organization that drove the creation of a category of cancer research, breast cancer, and turned a death sentence into one which eased suffering and created hope. For her work in breast cancer research, Time magazine named Nancy Brinker, founder of the Susan G. Komen Foundation, to its 2008 list of the 100 most influential people in the world. President Obama awarded her the Presidential Medal of Freedom, and I have been honored to call Nancy a friend for well over 15 years. Ambassador Brinker, please just say a quick hello and tell us what you're doing today, and thank you so much for joining.
Lisa, it's such a pleasure to be with you again, because this isn't like, Admiration Week, but you're a woman I completely admire. You always are able to move into a new frontier and do something interesting. And so I have to take my hat off to you. And I thank you very much. And I'm thrilled to be here today.
Well, I really appreciate it. And for people who are listening today, one thing to know is that when I was called by Korn Ferry and asked to interview for the FAIR position as CEO, one of the first people I called was Nancy Brinker. I knew that Nancy had pioneered cause marketing. She'd raised $1.9 billion for research, education, and health services. And I knew that she could provide me with some personal direction on what I needed to think about, how to grow an organization in the research category, key issues to be aware of. And Nancy has not only founded and done her work in breast cancer with Susan G. Komen, but she actually has a new effort that she's involved with, a couple of years old, called the Promise Fund. So Nancy, tell us a little bit about the Promise Fund.
Well, it's if you look at your life, Lisa, and the commitment you've made, like you have to analyze it. And I felt that I wanted to honor my sister. She asked me to cure breast cancer, and she asked me to do something about disparities, of which we were surrounded by people with disparities at the end of her life, when this was in 1980, when we sat at MD Anderson and saw the thousands and thousands of people who had turned out who had no money, no care, no hope to see a physician, at least in a timely manner. So this is the part that hasn't been done. And when I look at a problem, and particularly a problem you commit most of your life to, you have to say, what is unfinished? And what is unfinished that actually applies to a lot of Americans and people all over the world, actually, disparities of care and how we can deliver what we know in a timely, cost-effective, and accessible way. And that's what we're doing with the Promise Fund of Florida, and we're having great success. I'm thrilled by the people who've joined us in the effort and understanding how important it is to get people to have enough courage and enough understanding to be navigated by patient navigators to a point where they can access care. The care we render to them is subsidized and underwritten, so they have no payment for it. And we know we're doing the right thing, because if you look at the cost of care versus the disease outcomes today, you realize most of the lack of accessing care is cost. And if we can get it early, if we can reach diseases like breast and cervical cancer very early, which we now have the ability to do, it is astonishing how much we can save and apply to other parts of their lives.
Well, it's so important. And I know in the food allergy space, one of the key areas that we've really drilled in on is the need for access to care. And one of the things that we talk about, and, I believe you know that my husband's had a very unusual medical history. And so we've spent a lot of time in hospitals, both at Johns Hopkins and Stanford for the last 20 years. And I keep thinking about how easy it is for us to jump on an airplane and go to Stanford, or to get in our car and drive to Johns Hopkins. And it doesn't impact our lifestyle or our financial status from our ability to get a paycheck. And I think that the granular level at which you are providing this support is so critically important, because someone is living on an hourly wage. They don't have the flexibility to take off work and go do really the extensive amount of care that's required, plus the amount of time it takes somebody to get to the doctor's office. Maybe they have to take a couple of buses. So within that, it's changing the business model for how we approach philanthropy. And I know that's what you're doing with the Promise Fund. How are you dealing with some of those sort of daily just issues that someone has with a lifestyle that's not very flexible because they don't have the money, or they're not in a position to get the care they need?
So you're exactly right. And when we went to build this model, and it is a model, we're not building a national charity as I was with Susan Komen. We are building a model that other cities and communities are beginning to replicate now, because people want to get back in their communities, create more civility and success. So the first thing we do is the first thing we did was gather a group of patients who fell in this category as we were bringing on patient navigators. Patient navigators are people who are well-trained, maybe in nursing or in psychology, but they tend to be able to take people and direct them and hand on hand to where they need to go, and to get them familiarized with a very foreign concept, which is a hospital or even the federally qualified healthcare centers. And as we talked to people and understood, first, you seek to understand before you want to be understood, which I learned from a very famous philosopher one time, and Stephen Covey. And so in this case, we found that the greatest problem we were having were the social determinants of care, just as you mentioned. So those are the issues that keep people from therapy or from learning more. Number one is transportation. Number two was childcare. 3, food. 4, not losing your job. The very things that we think are simple, and they're not. We found most people didn't have transportation to the places we could treat them. So we have figured that out. We called our friends at Uber Health, and we told them we weren't planning on them having to do this for the rest of their lives in Palm Beach County, but we have the 3rd largest county in the 3rd largest state with some of the most dismal cancer statistics. So they agreed, and we use the Uber rides as economically as we can, but then we have now a way for people to get to the center or where we can send them for care. The navigator is number one. She reaches out in the communities where she lives. Every navigator we bring on has to be familiar with that particular culture, speak the language, understand their social environments. Where do they go? Where can they learn? How do they socialize this problem among women? And it is amazing how fast it happens. We were able to install a wonderful mammography screening center at one of our federally qualified healthcare centers, which most people don't know, but they probably end up going there. It's a federally qualified, literally, center bringing primary care to people. And we were able to partner with them and build a mammography center. We got a wonderful piece of 3D mammography from Hologic, the company that is very excellent at doing this. And 3 months after it was installed, we now have seen almost 1,000 patients. That shows you the number. We have 85,000 women in our county who have never been screened, nor do they have a medical home, because also the problem's complicated because we have 2 large for-profit healthcare systems who cannot render or do not render this kind of care. So that's really how it worked. We brought the pieces of the community that needed to be brought together, created a plan, and we're doing it, and we're executing. And so out of those almost 1,000 patients, we have uncovered probably 75 positive cases of cancer, about another 150 BI-RAD zeros, which simply means they see something, the mammographer sees something, and they have to be brought back to make sure it. And fortunately, most of these things are just that, tiny specks that can be seen again, and they are seen as not having a problem. But we now know they need to come back in 2 years. So we're really trying to fix the number and the system, and it's working. And we have a wonderful small staff. We have kept the cost out of this. And the office, if we need one, is my dining room table at home. We know it won't always be like that, but it's great. And everyone works virtually. And we have massive respect for one another. And we talk about it all day, every day, over and over and over until people understand who we are.
It's just amazing. It's so wonderful. You're really setting a prototype that so many of us need to replicate. I mean, as we were watching the country really take to heart some of the conversation around the death of George Floyd, I think that there were many of us in the medical care field recognizing how challenging it is. And I know, again, with food allergies, we're doing a program in Newark where it's allowing us to go into the community and understand. And the biggest issue, as you pointed out, is that people actually haven't been seen. They haven't been seen by a doctor. So the numbers are actually much, much higher than we even anticipated based on the research that we had done. And then in our case, access to food and their safe food that they can eat without an allergic reaction is rather significant. So what's been fun for me, and as we look at new business models, is we've actually been partnering with people in the cancer space who are looking at medically tailored meals. Great area to be able to identify sort of functionality that we can add into the system to ensure that no matter what food someone has to consume or avoid based on their the dynamics of their medical situation, that we can all work together in sharing things. And I know that partnership is so important to you. And one place where you really set the stage is in business partnerships. I mean, I don't think business partnerships existed to the degree until you came on the scene. And so maybe you can talk a little bit about, we hear a lot about business diplomacy, we hear about CSR, but if you're speaking to people right now and they're business people, what are the top things you're telling companies they can do to support the efforts that you have underway in Florida?
Well, and that's such a good point. It's certainly, there are many others. I can't claim to be the guru, although we were one of the organizations that embraced this concept very early on. And what we learned to do, which is something I'm not always good at, was listen very carefully to what the people from the company want and what they need to do. And if you can reach their needs and wants in a perfectly legitimate way and introduce yours, and they become 2 + 2 = 5, you really have something. And so many of these companies, Lisa, I think to your point, didn't realize just the way you explain it is brilliant. Imagine the money we will save if people understood that we could feed people with allergies at a much lower cost, because part of that cost is the treatment later on they have to go through and the early deaths and all that, and how much more we can add. So always we came at it from a positive point of view. Breast cancer has never been very much fun to talk about. Even in America today, we have about 250,000 women diagnosed with it. Over 40,000 die. Florida is one of the leading states in where we have breast cancer. So it's not fun to talk about this, but what is good to talk about is to light people's fire, whether it's a company or an individual, show them how it benefits them and where they will reach their goals. And the businesses we early partnered with were wonderful. American Airlines, Bank of America was an amazing partner of ours. On and on like that, all benefited so that they kept partnering with us and added, I think overall since Susan Komen began, the revenues have been almost $3.2 billion, all given away to communities and to research. And that's why it was time for me now to move on to the next part of what we really, really need to do. And you and I are very aligned on that.
It is. And I know that businesses are struggling, right? They want to do the right thing. They themselves were realizing it. And I think part of it, as you mentioned, is that we have to demonstrate how it's good for their business. And
Right.
philanthropy is good for their business and it's practical for their business because we can align our interests with each other. We can align our investments. We can actually, one of the key areas we're involved with, and I know that you have been also, is in data collection. We call data the regulatory circuit breaker. And so the ability of companies and the not-for-profit sector to align on that data is going to enable us to find those patients who are missing right now.
And you're so right, Lisa. You and I together, if we went and tried to find, there is a company out there. It's better to have a larger company who's used to doing community by community kind of data that we all need to collect. It's critical to have good data because when people see the actual numbers and they understand, my gosh, if we just did this, this would happen. And I couldn't agree with you more. There's a usefulness for philanthropy and also for your own employee base. Somehow, you're working not just for money to support your family, which is very important, but for the greater good. You're working to make a better world and a more humane world. It's a nicer experience going to work every day because in a way, it's not just work, it's dedication.
That's right. And I am so proud of the FAIR employees who have that dedication every day to show up for the food allergy community because it's a complex disease. People understand food, they can understand cancer, but when we start talking about food allergies, some people are more dismissive of it. So I appreciate what you're saying and appreciate also the construct of how we can better engage business in helping us solve the problem. I want to pivot here, which is to talk about mentorship. You are an amazing mentor. You've been available to so many of my friends. You've been available to me as a consult whenever needed. You're going to find a little note about you at the back of my book that I'm launching in October because you have always been there. And you're one of those people that has picked up the phone. And when we ask a question, you help us. What do you see as the best principles that people need to adopt in order to be an excellent mentor?
I think to be an excellent mentor, you have to be authentic. You can't go to a coaching class which teaches you how to be animated or whatever it is.
Right.
It has to come from someplace deep inside in what you believe. And when you do that, and when you do it over and over and over every day, you're setting an example. I appreciate you calling me a mentor. Really and truly, I don't see myself that way. I love being discussed that way just because if I can increase people's satisfaction in what they're doing, that's a huge win. And I think you have to over and over give examples of how to fix something. Don't be afraid to be creative. Take the time to listen to what your colleagues who are working with you are saying because they're learning things you're not. You may be looking at the overall picture. Can the organization survive? How are we going to have the funding, et cetera? But if you listen, you will find kernels of ways to extend that very issue into a cause, into a desire to do it. And then the other thing, and I told you this earlier, my father used to say to me, it's not that you are not intelligent enough. It's not that you don't have good ideas. It's that if you don't succeed often, it's just because you quit. And this has happened to me so many times, and I know to you, I get to the end of something sometime and I want to pull the rest of my hair out and say, oh, this isn't going to work. I don't think I can do this one more day. Why do I have to explain to somebody the social determinants of health? Why do I have to talk about how poverty affects all of us? But once you say to yourself and you go to bed and you're a little discouraged, somehow you'll wake up the next day and something will happen. I can't promise it, but I can tell you it's happened to me more times than not. And the other thing is to always remember to tell a story. Tell a story about why you're doing this. You just told it beautifully about your husband. People don't understand these, become personal. Think about everybody you're helping as being your next door neighbor. That's all. And what can you do? And Americans are the most generous people in the world. Alex de Tocqueville said it so many years ago about Americans. We still are that way. People want to help. They're ready to come back to their communities. They're ready for civility. So if I am a mentor, I hope it's because I just keep doing it over and over and over again until finally somebody says, there may be some truth to what that woman's saying.
Well, I always know there's truth to what you're saying, and I know that there's great value. But it's interesting. One of the things that you highlighted is that a mentor is also always a mentee, and I believe strongly, and I do regular one-on-ones with all of my staff, because being able to listen to what's going on, as you mentioned, has that kernel of truth, which is actually going to help guide us in our decision making. And I know I too am one of those people that I'll just be so discouraged going to sleep at night, but my brain doesn't shut off, and all of a sudden I start problem solving, and I'm like waking up at 5 a.m. and writing down the answer to the question I haven't been able to solve. Unfortunately, that happened to me today, so we had to use a lot of makeup to get ready for this interview, but it does work. So let me ask you, what women inspired you to break through?
Well, I think always people like yourself who aren't afraid, who wake up and somehow find the courage to say, I may be laughed off the face of the earth today, but I'm going to do this. And if I fail, I'm not going to cry and get upset. I'm going to pick up my ashes, as my mother used to say, and move to the next place. And I think that's really what it is. Never being able to be dissuaded from what you believe, your neighbors, the people you work with, your core values, what they tell you, believe it and keep practicing it every day. And the other thing is, be as generous as you can. And I don't mean it with just your pocket money. I mean it with your soul. So that if somebody calls you late at night and you are exhausted, and you just said it so truly, sometimes people do call me at 3 a.m. And it's my way of being generous. I talk to them. I try to get them back to sleep and get them to offer to call me when they wake up. Because it says that you really, there's someone there to hold your hand. That's the most important thing you can do ever to get people to listen and to do and to understand. And I think you do an incredible job, by the way. And I think we're very lucky, you and I, we both know a lot of women who are incredible that way. It's being willing to do it yourself and give until it hurts, and then give some more.
That is great advice for young women who are watching today, because the daisy chain that we have, there's a group of women that get together for lunch that Nancy and I are a part of. And we don't meet that frequently, but we would get together once a quarter. A friend of ours would host it. And it's really a wide range of ages, but there's that commitment of supporting each other, that commitment of helping each other, and being that person. I have to tell you that when there's some of us that about 20 years ago, we would say, oh, I want to be, when I grow up, I want to be Judy Black, or I want to be Nancy Brinker. and now we're older, and we're like, wait a second, I am Judy, I am Nancy. But even last night I was at an event and met a college student who is doing Russian, Chinese, and cybersecurity. And I'm like, oh my God, you've got to meet my husband. So it is that giving back. And I think that's what you're saying, is you inspire the next generation of women leaders by showing them how they can be the next generation of women leaders. As we wrap up, we've got women who are out there that want to break through. We've just gone through the pandemic. People are struggling. Some people are ready to move forward. Others are going, I'm not quite sure I'm ready yet. What's your number one piece of advice?
Well, and I didn't answer your question about my two great mentors in my life. The first one would be Mary Curie, Professor Mary Curie, who developed radium. And if you read, and I suggested every woman read that book about how she won the Nobel Prize. No woman has done this since, twice before she was 40 or 50. And what she did to do that, constantly re-energizing herself, reimagining, doing things that I could talk all day about. She was so amazing. And then another great mentor of mine was Betty Ford, who was the wife of Gerald Ford, our first lady, who had breast cancer and had the courage to come out and talk about it. And so I move from that into the answer of your question. Just keep going. You may have a bad day, but measure that bad day against all the days of your life and say, it's one day it's going to help me tomorrow, and I'm going to keep going. And that really is almost 99% of it. And try to share what you know, and take the time to mentor other women, even if it's an hour a week, because that's the way we'll get to making our lives better and our children's lives better, and if we have grandchildren, better. And that's our duty as citizens, as human beings.
Well, what a wonderful way to end our interview. Nancy Brinker, thank you so very much for empowering so many of us. There are women across this country who are empowered to do cause marketing, to run those races, to get out there and support the underserved communities, really through your leadership. So thank you so much for joining.
Thank you. And Lisa, come and see us. And I want to show you all, walk you through the Promise Fund. And I invite everybody to go on the website, promisefundoflorida.org. Thank you for having me. It's been a great joy to see you, and congratulations in all your work.